Welcome to Academy of Nutritional Sciences Hospital Dietetic Internship e-learning program. It's a comprehensive clinical training pathway for aspiring dietitians seeking rigorous, practice-ready skills in hospital nutrition care. So today we are going to learn about how to be prepared for hospital dietetic program and your internship program before you enter the hospital. So the reality is that hospital dietetics is beyond meal planning. Hospital dietetics extends far beyond only recipe creation or meal planning. It is a clinical discipline rooted in evidence-based decision making that is directly influenced by patient recovery strategies as well as hospital length of stay and the long-term health outcomes. Number 2, precision in nutrition. The field demands precision in nutritional assessments, meticulous documentation practices, and professional accountability within the multidisciplinary team healthcare teams. So why most interns feel unprepared? So either there is many reasons for it: unstructured thinking, there is a limited hospital exposure in various rotations or different departments. There is sometimes lack of training in documentations, and there is fear or anxiety in meeting patients in the ICU or in palliative care. So let us see how we can overcome the real situation. What a real clinical dietitian actually does is the core of the clinical responsibility. Whilst she assesses medical history and lab reports, calculates individualized requirements, writes the clinical nutrition plans, documents in medico-legal formats, participates in clinical rounds. So what she does, each step requires a very clinical expert thinking and precise protocols, right from taking the dietary history, laboratory measurements, calculating their targets, making a nutrition plan, and also documenting what you have spoken to the patient. So clinical rounds, which is beyond theory. When you actually do your dietetic internship, you will realize that the theory is good, but when you take clinical rounds, there is a lot of critical thinking that you have to do. So you first of all, do not ever meet the patient without looking at the case review. Pre-round case review is essential. Bedside patient assessment is also very essential. What you do, what tools you use, whether you use a subjective global assessment, you take the dietary history, you do the ABCD method. You are in consultation with others, the medico-legal team, with the medical team, with the doctors, physiotherapists, pharmacists, and so many other people. And it's a real-time modification. You have to take decisions then and there. So pre-round preparation is basically an essential step in the effective clinical rounds that begins with thorough preparation, systematic approach which ensures you to enter patients' interactions with complete clinical context and clear intervention strategies. So you have a case review sheet where you look at the detailed analysis of the patient's notes, the discharge summaries of previous admissions, and the progress notes. Also, there is a diagnostic understanding, a comprehensive and primary secondary condition where surgical procedures and complications are understood more clearly. Then there is a medication reconciliation and risk identification. You look at the drug nutrient interaction, you look at the appetite, you look how much the patient is consuming, and you identify the risk. Suppose the patient is at a risk of swallowing, so you identify the dysphagia risk. You have a structured bedside assessment. Here, besides anthropometry, maybe the nurse does the anthropometry, maybe in some setups the doctors do it or you have to do it. You do anthropometrical measurements, sometimes body compositions are required, fluid balance and monitoring, assess ABCD, that is the appetite, tolerance, and the clinical goal. So you enter the patient zone very, very professionally. Remember that you have to look like a dietitian. So professional introduction is very important, where you have a clear identification as a clinical dietitian. You explain your role to the care team, and you have an obtain a verbal consent for the patient's nutritional assessment. So when you go and speak to the patient, you have to tell the patient why you are meeting him or her and tell them what you are going to do. But very important before that is identifying the right patient. So there are various means in which you can identify. You can identify the patient not only by the name, because you can have two patients by the same name. So not even by the bed number, sometimes there are transfers. So you have to definitely look at the full name of the patient and the date of birth, and confirm with the patient that it is a right patient you're talking to, because you have to put your notes accordingly. So your communication ethics have to also be appropriate. Your language has to be very empathetic, and you have to have a empowerment where you are able to listen to the patient carefully. You also have to be culturally sensitive to the patient. You cannot ask certain questions to a patient which is not culturally sensitive. You can't ask questions directly with relation to religion, with the income, with their caste, with their any other aspect which will culturally feel them hurt, or they will get they will not want to talk to you. So you have to adapt and communicate in that style. Also, you have to maintain their dignity. Okay, while speaking to the patient, or you are taking an assessment of the patient, see that you are taking in a closed environment, and that many other people, and you are not a spectator to other patients. Even if it is in a general ward, there is a curtain, or there is some way where you have given the patient good privacy to talk to you in person. Remember, privacy and maintaining patient dignity is very, very essential. You have to respect the personal space of the patient, conduct the examination very sensitively, and make the patient very comfortable. Also, you have to follow certain rules which could harm the patient, especially the infection control protocol. You have to, as soon as you enter into on the bedside, you have to use a hand sanitizer. Sanitize your hands in the process the way sanitization is taught to you. Use personal protective equipment wherever required. If you need a mask, you need like in transplant patients, we need an entire equipment of protective equipment. You have to know the right way of even removing those protective equipments before you go to the bedside of the patient. Then is coming to the documentation. There is a particular format in which you need to document what you have found out in the patient's records. Now, medico-legal documentation in the standard that is required, because in case there is a medico-legal case, your statements have to be correct. So you use objective data, you use a PES statement framework, and you explain in your progress note what is the intervention planning that you are doing, how are you monitoring and evaluating the patient, and it has to be in sync with your hospital protocols. Then comes to your accreditations, levels and documentations. Now you have to have excellence in record keeping. You cannot just take the height, weight, BMI, body composition of the patient and keep it in your notes. You have to transfer it somewhere. You may be shadowed by your buddy or your preceptor or your trainer dietitian. So first of all, get it corrected and checked by them. If you're allowed to use the system and you're putting it in the system, before you release it, first show it to your preceptor, show it to your trainer, show it to your buddy. Whether it is the admission notes, whether it is your daily notes, whether it is just initial administration, or it could be just a discharge diet that you are giving. But since you are an intern, you may not have the privileges to put certain things in the system. So you have to show it to the right person before entering it into the system. Then there are certain hospitals which have quality standards. They follow NABH, JCI, ISO. Whichever compliance they are following, you have to use the policies and the format, the hospital has given you. So where before entering to the hospital, you have to learn what are their formats. What is JCI? It is basically a Joint Commission International Quality Approval System. NABH is the Patient Safety and Quality Care, which is an Indian organization, as well as ISO, specially used in the F&B and the kitchen areas. Also, there are other areas which are used, such as laboratory, etc. But for us, the concern is our kitchen ISO certified? Then comes to your risk screening and tools. You have to identify early. Your main core role is to identify the patients at malnutrition. There are certain protocols the hospital follow. Some may tell you that you do it within 24 hours of the patient's admission. Some may say earlier, some may say a little later, but follow the hospital protocol. Also follow the guidelines, whatever the guidelines are given you, whether it is Indian guidelines, ESPN guidelines, ASPN guidelines, pediatric guidelines, whichever is the guidelines, you have to follow the guidelines. Based on that, you can either use any of the tools that are recommended by your hospital. It could be the MUST, which is usually used in the OPD. It could be the NRS 2002 screening, which may be used in the ICU setup. In the ICU setup, you may also use GLIM criteria. You may use the Nutrix score, the M-Nutrix score, or you can use just a subjective global assessment. Now, these assessments depend upon what you need for that patient. Also, sometimes ICU could be overwhelming. I have found students who come in for an internship, maybe for 4 weeks or 5 weeks, and they want to have an ICU exposure. Remember, critical care unit is a very supported, nutritionally supported, and a very critical unit where a lot of decision makings have to happen based on your background knowledge, on your theory knowledge. So before you enter the ICU, remember to read your theory very, very well. Do not confuse between enteral feeding protocols, parenteral nutrition protocols, SPN, that is supplementary parenteral nutrition, and you have to also observe the feeding tolerance and do certain calculations. So you cannot be shy of numbers. Also here you have to remember the doctor may use abbreviations, and if you do not know those abbreviations, you may be lost. So they may use the abbreviation of NBM. So NBM is nil by mouth, but some hospitals may say NPO, nil per order. So some hospitals use different abbreviations based on what abbreviations the entire hospital has decided for. Certain abbreviations are used universally, like we use the word RT, that is Riles tube. You cannot confuse it for renal transplant. So similarly, when you are using abbreviations, you have to know the right abbreviations. So even when you're dealing with the F&B staff, sometimes you use the word BF, which stands for breakfast, but it is not a universally accepted abbreviation. Similarly, FD may be your abbreviation that is understood both by you as well as the F&B, that is full diet, but it may not be understood by the doctors or the nurses. So you have to see to it what is the abbreviation that the hospital has decided to communicate in an easy manner to the rest of the team. There is no hard and fast rule for abbreviations, but certain abbreviations like medical abbreviation, which are like CKD or AKI, these are medical abbreviations which also you have to know, which are universally used. So make a list of your abbreviations, keep a notebook with you. When you are on your rounds, try to make a list of abbreviations so that when it is repeated, you know what the doctors are talking about, or else you may get lost in all the abbreviations. Also, when there is enteral and special diets, it's a very, very high clinical priority. So you have to know what is a renal diet, what are the fluid and electrolytes controls, what are the normal laboratories, how you have to match it with the patient's laboratories, how if a patient is on a diabetic carbohydrate management diet, what are the kind of foods and vegetables and fruits you can give it to the patient, what is available in your kitchen to what the patient can get from outside. So if the patient is getting from outside, does your hospital have a food pass policy? Find out about that and give accordingly. So whether it is flexible implementation or it is a strict adherence, Everything depends upon what is your hospital going to have as their protocol. Also, when it comes to hospital diet management system, follow the robust diet management system that ensures accuracy from the prescription to the delivery. So the dietetic department must maintain a comprehensive diet manual with standardized codes, and it should align with the medical protocols. So whether it is diet codes, doctor's orders, kitchen coordination, or any other real-time adjustments. What I mean by real-time adjustments, suppose a patient has come in the time where your food has already left the kitchen and it has gone up to the patient, and a new patient has come on the bed. Then would you serve the same old patient's diet to the new patient? No, right? So that's when you have to do the real time adjustment. You have to follow the hospital protocol for the real time adjustment. Then comes to your tray verification and food service. Very, very important that you do not give the wrong food to the wrong patient. You have to ensure that your tray is accurate and critical to patient safety and treatment. You cannot give like a non-diabetic tray to a diabetic patient. You cannot give a non-renal friendly tray to a kidney patient. Now this is very important because you have to coordinate with the F&B for tray preparation. Suppose a patient is allergic to any one item, say a besan, and a besan is like in the gatuna shak, which is like a besan balls in a vegetable, and you don't know the meaning of the word gatta, where you and the patient is allergic to that, so you have to have a team to check the allergies. Also, there has to be a compliance of the diet and delivery confirmation. All these things are very important when you are in a hospital setup. That is why I said all these things may not be taught to you in your college, because that is theory. But when you are actually on the ground level, these are the actual challenges that you will face. Also, hospitals do have other departments like the OPD, counseling setup, where you have to understand lifestyle based planning, compliance strategies. You have to also write documents for them for follow up. Suppose a patient has come to you again after 3 months. You may not remember his height, weight, or what he has come. But if you have your documents well prepared, you will be able to speak to that patient in that same fashion. Also, handling real hospital challenges. Now, what do we mean by real hospital challenges? Is when a patient may be non-compliant, may tell you, I don't want to eat this. Maybe a geriatric patient or a pediatric patient refuses to eat and says that I want only this item. How you are your way in which you can counsel the patient, you can talk to the patient, you can make changes in the diet, you can speak to your chef, make changes in the menu. There are many various ways in which you can modify and you help the patient eat well. Also, when it comes to decision making of complex cases, follow the algorithm, follow the protocols, get into a multi-disciplinary team conversation, ask the doctors, ask the dietitians, ask your senior dietitian for help here. Sometimes you need to restrict fluid in certain cases, sometimes you need to restrict carbohydrates in certain situations, but at all times follow the evidence-based approach. Also, patient safety and ethics. Clinical dietitians work in a very high risk environment where infection prevention is paramount. Following strict hygiene of hands is paramount, and protecting the patient as well as yourself is of most important. Out of everything, the most important aspect is confidentiality. Do not discuss patients outside the patient's setup, especially in the lifts, in the corridors, in the trains, in your home place, or in places where you can compromise the confidentiality of the patient. Even if you have got a very important patient, a VIP patient, a celebrity patient, you should not be talking about those patients outside anywhere, because the patient trusts you and that you are going to keep their matter confidential. Also, when it comes to certain other ethical documentations, counseling, isolation precautions, avoid misinformation, use your PPE carefully. Certain hospitals, like in the way we are, we also give training for fire safety for our dietitians. We have a 3-day induction program where everything from fire safety to hand hygiene is explained to our interns before they come on their internship job. So they have been given training in all these areas, including the cardiopulmonary resuscitation. So CRP training is also given to them, because we do not want to take any risk with the patients and an intern being there at the same time. So there are many aspects to a hospital internship, and you have to follow it, whether it is monitoring, follow-ups, diet intolerance, intake output chart, lab reviewing, or a discharge planning. So professional identification of a dietitian is clear authority, accountability, leadership in nutrition care, and a continuous learning. So from a student to clinical professional, remember, structured thinking, clinical confidence, system understanding, and professional behavior all are very essential. So what will you be competent in? Independent handling of cases, writing clinical notes. You will be able to plan ICU diets, tube feeds. You may be able to, even if you do an internship for a longer time, you may be also able to be the auditor of documents. Then you have to have basically a career pathway. Certifications are important. You will not just receive a certificate for your internship, but you will be ready to come out into the world to actually be by yourself as a clinical dietitian and become hospital ready. You earn a lot of competence. Your doors will be open to advanced clinical roles. But if you go for a hospital internship, which may just be 2 months or 1 month, you may not be able to learn every aspect of a clinical hospital dietitian. I would suggest that if you are really interested in doing a course on hospital internship, do join the Academy of Nutritional Sciences. Go on to the website and check out the courses in advance, so that you are able to be hospital ready before you actually go in for internship. So this is a very crucial internship, and you should make most of it, and you will be an intern only now in life. Later on, once you get into full-fledged, you will learn, but you will learn in a different manner. So join the program if you want to feel confidence, whether it is ICU or professional, or you want to just upgrade your knowledge. It is very, very useful to you. I leave you with a thought, and please do contact me anytime you need. My contact details are coming up, and if you need to talk to me directly, please do not hesitate to call me or WhatsApp me. If you want to join the course, you can go log on to Academy of Nutritional Sciences. You can send them a WhatsApp text or a email, and I'm sure they'll be ready to help you. If you have any difficulties, let me know. These are some of the books which I have released. That is Swallowing Smart. I've also released Nutritional Pathways and Transplant Success, and a vegan friendly book for rice protein isolates, which is called Rise and Shine. So these are the contacts of Academy of Nutritional Sciences. I thank Academy of Nutritional Sciences to allow me to give you this talk today. Thank you so much.